So I'll be talking on blood pressure medication and its recalls, all right? Understanding the risks, recalls, and safe alternative. How to stay informed and protect your health when you have blood pressure, which is BP. So this is going to be like a patient guide to blood pressure, drug safety, and FDA recall. All right, so hope we are ready. Get your pen, get your paper, stay with me, and I know you will enjoy this session with me. But firstly, what really is blood pressure? Who can explain what blood pressure is? A lot of us have been hearing blood pressure, BP, blood pressure, blood pressure, blood pressure, blood pressure. But now the question is, what do you understand by the word blood pressure? So please drop it in the comment section, invite your friends to join, and let's do this. So understanding blood pressure and its management is very important and very essential. Like as I said in my previous video, that our heart is the power as of our body that pumps blood. So it's very important, and this blood carries oxygen. So I'm going to give a scenario like this afternoon, like this the sun slightly went through the blind of a small clinic, and it was just casting warm line across the tile floor. There is a patient sitting down there, which her name is Mary. She sat quietly at the edge of the examination table, and a handbag by her side against her chest. She had come for what she thought would be normal routine checkup. We all know and encourage us to go for a routine checkup, and that was exactly what Mary did that very day. Mary went for a routine checkup because a healthcare professional, someone like me, told her, Mary, you need to go for your routine checkup. It's very important. You need to go for your routine checkup, check your blood pressure, check your vital signs, which include your respiration, temperature, BP, and stuff like that. And Mary took the bold step. Since she have not been going for checkup for a long while, all right, no problem. I want to go and check myself. Although I've been having some sickness all over my body, let me go and check myself. So that fateful day, Mary went, and she was there. She had come for what she thought would be routine checkup. When the nurse wrapped the cuff around her arm and pressed the start button, we started checking her. She smiled politely, unaware that this tiny device would deliver news that would change her life. 150/90, the nurse moaned, frowning slightly. Mary blinked. Is that bad? The nurse offered a reassuring smile. We will check it again. Sometimes stress or rushing can make it rise, because she was already having anxiety. Like, is my blood pressure high? Am I hypertensive? But the second reading was no different from the first reading. It was in that moment that Mary first heard the word hypertension. All right? It sounds almost foreign, a word for someone else's problem. Sounds so foreign to her. Yet that day, she learned it wasn't just a number. It was silent force working behind the scene, shaping the heads and fate of millions around the world. I want to let us know that high blood pressure have shaped the earth and fate of millions around the world. That is why I'm always shouting and I'm always emphasizing that please do your routine checkup. check your blood pressure. It's very important. It can never be overemphasized. And I am still shouting right now. Please and please check your blood pressure. All right. What is blood pressure? To understand Mary's story and that of countless others, we must first understand what blood pressure truly is. Imagine the heart imagine the heart as a study, tireless pump sitting in the center of a vast pumping system. Now, each beat sends life-giving blood crossing through an artery. As your heart is beating, each beat send life-giving blood crossing through arteries. As your heart is beating like this, as it's beating, it's sending life-giving blood crossing through arteries. The elastic pumps that branch out to every corner of the body. So you can imagine. And this blood carries oxygen, nutrients, and warmth, fueling every cells and organ in our body. But for the blood to move efficiently, it must push against the wall of the arteries. That force of blood against the vessel wall is what we call blood pressure. I hope we are following, and I hope we are understanding this class. That push is what we call blood pressure. So we have to understand this, that the heart is doing a lot of work. When your healthcare professional talk about blood pressure, they mention two numbers. For instance, 120/80. This aren't just random number or random figure. The top number, called systolic pressure, measure how much force the blood exerts when the heart contracts. The down number, diastolic pressure, shows how much pressure remains in the arteries when the heart rests between beats. So for the body to function well, both numbers must stay within healthy range. Too low and vital organs may not receive enough blood. Too high and the arteries face constant strain, like pipe under excessive water pressure. So I'm encouraging us, please keep your heart healthy. For decades, 120/80 has been considered an ideal target for adults, but blood pressure isn't fixed. It changes every moment. When you walk, when you eat, when you laugh, or when you even run, all right, it reflects not only your physical state, but also your emotional world. Stress, fear, excitement, all leave their signature on the pulse of life. Now, the danger begins. I said it again. The danger begins when the blood pressure remains high consistently over time. This is hypertension. A silent, persistent rise in pressure that gradually damages the arteries, the heart, the kidney, and the brain. I hope we are following. As I said earlier, take your pen, take your book, and please jot down. So I will be going on to talk about how blood pressure creeps in. The silent climb. How did it actually creep into your system? Just like Mary's life, the scenario I gave at the beginning. All right, like Mary's life, like many others, this didn't just change overnight. No, there was no sudden pain, no dramatic symptoms. High blood pressure rarely announces itself with a trumpet. All right. High blood pressure rarely announces itself with a tropen. It does not do that. It does not do that. You will not see it announcing itself with a trumpet that, hey, I'm coming. Hey, I'm coming. It does not do that. All right. Instead, it climbs quietly, year by year, building pressure like an unseen tide. So your healthcare professional often call it the silent killer. It does not hurt as it builds. It does not make a scene as it builds. Nothing. Yet inside, it slowly stiffens the arteries, weakens the heart, and increases the risk of stroke, heart attack, and kidney failure. Now, what makes it so widespread? The causes are really simple, very, very simple. And that is the reason why it's so widespread, because the causes are so simple. Hypertension is not a single disease, but a combination of influences like genetics, lifestyle, diet, and even emotions. Some people inherit a family tendency towards high blood pressure. For others, it's shaped by the rhymes of modern life, the hurried meals we eat, the long hours at work, the salty conveniences food we eat, the lack of rest, every cup of instant noodles, every night spent staring at a glowing phone screen instead of sleeping, every skipped morning walk. All this add up. Little bricks in and little bricks in an invisible wall. This causes high blood pressure. So, I will be talking on the causes, risk factors that causes high blood pressure, the webs of this hypertension. All right. If you could step inside of your body, you will know that this individual, like for instance, if you could step inside of a body of an individual with chronic high blood pressure, you will see how they are. You will see it, the wave inside the body. You will see how it is going. All right. Now, first of all, what are these risk factors? What are the causes of this high blood pressure? Genetics and family history. Sometimes the story begins long before birth. A parent's blood pressure patterns can pass silently to their children. It does not mean destiny is fixed. No. Or it doesn't mean destiny is fixed, but it sets the stage. So that is the reason why we need to know our family history concerning blood pressure. It's very, very important. What about diet and salt in many homes? Salt is love, sprinkled generously over stews, soup, and snacks. Yet sodium in high amount makes the body hold onto water. That extra fluid increases the volume of blood, rising the pressure inside arteries. Over time, this pressure stretches artery walls, making them less elastic. This is the reason why I always emphasize, why I always shout, why I always scream concerning our diet, concerning our salt intake. You will see some men, their wife, after cooking for them, they would open their mouth and they will say the food is not salty, and they will take a salt and start sprinkling the salt in the food. That is dangerous. And I also emphasize on sea salt. Sea salt is very vital and very important for us to take. Now let's go on to obesity, and physical inactivity. A sedimentary lifestyle, hours in front of desks or television, weakens the heart efficiency. All right, so when you are working or you have sat down in front of a desk for a while, please, I encourage you, take a walk, sit up, stretch out yourself, and take a walk. This will help your heart to pump blood very, very efficiently. Because when excess weight gain creeps in, it will not help your heart at all. All right. Now, the heart pumps blood harder to move blood through the body. This increased strain on your heart. So, obesity and physical inactivity can be so dangerous to your heart. Please, let's take note of this. What about stress? Stress and emotional strain. This help our heart to be weakened. All right, our emotions are not just feelings, they are chemistries. All right, each wave of anger, each wave of anxiety releases hormones like adrenaline and cortisol, which tighten blood pressure and quicken the heart. All right, a single stressful day might not harm much, but years of tension can slightly or silently reshape your cardiovascular health. Cardiovascular health also means your heart health. All right, what about alcohol and smoking? This is very dangerous to our health. I have shouted, I have screamed. Please, taking alcohol excessively, in fact, you are not even encouraged to take alcohol. Talk more of an individual taking alcohol excessively. This is dangerous to your health. All right, please pardon me. Alcohol and smoking is very dangerous to your health, and this can damage your heart muscle and alter blood pressure regulation. Please, smoking is not encouraged. All right, because smoking narrows the arteries, forcing blood to move through tighter space, and this will rise the pressure and cause risk. All right, medication condition and age. Yes, a lot of medication can also affect our blood pressure, but we need to take conversation of that. I will come back to talk on that. That's not our topic for today. As people age, arteries naturally lose their elasticity. Chronic illnesses like diabetes or kidney disease can worsen the situation. So, creating a cycle that fuels further blood pressure to increase. When an individual is already diabetic or an individual already have kidney disease, this is already creating a cycle that can even further fuel blood pressure increase. So please, let's take note of that. Now, what does blood pressure do? What does it do? Like the scenario I gave earlier, Mary's healthcare professional explained gently to her that she needs to change her lifestyle for her to stay healthy, well vitalized, and well fulfilled. All right. Now, what are we going to say about Mary? What is she actually going through when we told her that This is your blood pressure reading. How did she feel like? When we are talking about hypertension, there is an emotional side of management when it comes to high blood pressure. Because hypertension management is not only physical, it's deeply emotional. Alright, so we need to look at the emotional aspect. Many patients struggle with guilt, frustration, or denial. They ask themselves, why me? Or will I live with this forever? Like the scenario I gave earlier, this particular patient felt the same way. But over time, she realized that managing blood pressure was not about punishment, but it's about partnership with her body. So you need to partner with your body to be able to overcome blood pressure. Her diagnosis became an invitation to live more mindfully. All right. Now, doctors, nurses, and patients alike must see hypertension not as failure but as a signal, a reminder to listen, a reminder to adjust, and a reminder to care. Support from family, friends also matters a lot. When loved ones join the journey together, cooking healthier meals, working together, encouraging regular checkup, control becomes more better, easier, and even motivation becomes stronger. And you will see that people are living more healthier and more stronger. So what am I trying to say? We need one another in this journey. Now, what is the global perspective when it has to do with hypertension? Across the world, hypertension affects more than billions of people. A lot of people are experiencing this hypertension. That is the reason why we need each other. In bustling city, orderly city, quiet villages alike, the same story unfolds every time. People unaware, unthreatened, or unmonitored. When you are not being monitored concerning your blood pressure, you see that it keeps increasing. And a lot of people in the village, when they are untreated, the high blood pressure keep going higher and higher, and a lot of people don't know. Ignorance also is an issue here. The global rise of processed food is dealing with us. Urban stress and sedimentary lifestyle has become dependent, and this has caused this crisis of high blood pressure. That is why the story of blood pressure management need natural the story of blood pressure leads naturally into the next generation. The story of blood pressure medication recalls is what we have to deal with. The story of blood pressure recalls must definitely be emphasized on, because while medication save lives, it must also be safe for it to save life. All right, because if the medication is not safe, definitely that medication cannot save life. When a recall happens, when a batch of drug is found to contain harmful impurities, it shakes the foundation of trust between patients and the system meant to protect them. But understanding blood pressure itself, as you now do, gives power, it gives strength. It reminds us that health begins not in the pill bottle, but in the awareness of how the body works and how to care for our body daily. That is why it's more important and most paramount to do self-care. All right. When I mean self-care, I mean self-love. A closing reflection on Mary medication, Mary history, because when I started with a scenario concerning a patient named Mary. When Mary left her health professional office. Months later, her reading has dropped to 120 over 78, which is very, very much encouraging and normalized. Her steps were lighter, her breathing easier. She had not only managed her pressure, she had changed her life drastically. The monitor bumped softly, confirming progress, but it was more than a number. It was a story of learning, discipline, and renewal. And somewhere inside her heart, that quiet, faithful pump beat steadily, not even the way it was beating initially when she came. All right, and we have some common blood pressure medications, like I discussed in my in at the beginning of this class. Blood pressure medication, they are so common, bridging from understanding to action. You need to understand your drugs, understand the mechanism of action, and be able to know the type of drugs to take. All right, in my in the beginning of this video, we explore what blood pressure means, why it matters, and how hypertension silently affects millions around the world. Knowing the why behind blood pressure management is the first victory. Knowing the why beyond blood pressure management is the first victory in which we need. And I know that we are following and we are comprehending whatever I am saying. All right. The next is understanding how to manage it effectively. For most people, lifestyle adjustments like healthy diet, regular exercise, stress control can bring member closer to normal. All right, when you engage in regular exercise, it can bring your numbers or your blood reading closer to normal. But for many others, these efforts are not enough. And when these efforts are not enough, what do? We include medication to it. When the body resists this gently natural method, your health professional turn to varieties of medications designed to help the heart and arteries work more efficiently and effectively. These medications do not replace healthy living, but what do? They reinforce it to truly manage hypertension. It's crucial to understand the tool that modern medicine offers, not just by their names, but by how they act within our body. That is why the mechanism of action concerning blood pressure comes in. Now, in this chapter, I will be talking about 5 main classes of blood pressure medication used worldwide. A lot of blood pressure medication is being used, but there are 5 main classes of blood pressure medication used worldwide. And you knowing this is going to help you in your hypertension blood pressure management. Firstly, we have the ACE inhibitors. Secondly, ARB receptor blockers. Thirdly, beta blockers. Fourthly, calcium channel blocker. And fifth, we have the diuretics. Each of these medications has a unique way of controlling blood pressure, and understanding their mechanism, benefits, and potential side effects can help patients and caregivers make informed decisions, especially in the context of medication recalls, where awareness can literally save life. When you are aware of the particular type of drug you are taking, I want to let you know that it can save your life. It's very important and very essential for us to know the type of medication we are taking, the side effects, the mechanism of action. All right, now let's talk about the ACE inhibitors, calming the blood pressure hormone. This drug, what does it do? It calms the blood pressure hormone. These are among the oldest and most trusted medication for treating blood pressure. And to understand how they work, imagine your blood vessel as a system of flexible hose that carry fluid under pressure. When the hose tightens or narrow, the pressure inside will increase. In the body, this tightening is partly controlled by a hormone called angiotensin 2, and is a powerful constructor that tells blood vessels to narrow and hold onto salts and water. ACE inhibitors work by blocking the enzyme that produces this hormone. As a result, blood pressure relax, and blood vessel relax and widen, lowering blood pressure and reduces the heart workload. So this is the work of this. This is the work of this ACE, which is ACE inhibitors. It helps to control this angiotensin 2 receptor that blocks the artery when blood is being pumped. And some common generic example of this drug is lisinopril. Lisinopril is a generic name of a blood pressure drugs. All right, you might encounter different brand version of this medication, but what matters most is their active ingredients inside the drug. Is the active ingredients that matters most. There are different brands of these drugs in the market, but what actually matters most in this drug is the active ingredients inside the drugs. Please, let's take note of that. The generic name like lisinopril identify the true chemical substance doing the work. The drug doing the work, the active ingredient doing the work is lisinopril. Patients should always check that name when reviewing prescriptions, especially during publicized recalls. All right. ACE inhibitors are often prescribed not only for hypertension but also for heart failure, kidney protection in diabetes, and post-heart attack care. They have dual benefit: controlling blood pressure and protecting vital organs from long-term strain. So I hope we are jotting and we are with our pen and paper. You can still save this video for future purpose. All right, common side effects. All drugs have side effects. Majority of drugs have side effects. Some common side effects of this lisinopril that a persistent dry cough is the hallmark side effect of ACE inhibitors. Yes, you see that individuals that, so you don't have to complain when you are on lisinopril. You should know that one of the side effects of lisinopril is dry cough. So please, let's take note of this. All right. Now, some patients also experience dizziness. They also experience fatigue or mild increase in blood potassium level. You see that your blood potassium level is being elevated. Rarely allergic swelling. Rarely some patients experience allergic swelling. It is rare for the side effect, but it can actually occur. All right. A medical emergency requires prompt attention. When you're on this drug and you have a medical emergency on any of these side effects listed, will definitely attend to you. your healthcare professional will be there to attend to you. Why these drugs matter, why ACE inhibitors matters, is that ACE inhibitors are foundational in modern hypertension therapy. They are often first line of defense, especially for patients with diabetes, heart disease, or chronic kidney disease. In cases where recalls occur, your healthcare professional carefully substitute these with equivalent ARBs to maintain therapy without interruption. Your therapy needs to be maintained without interruption. I know you'll be asking, what is ARB? I'm talking about ARB right now. It's also among the 5 class of BP drugs that is being recognized globally. All right. Now, these ARB drugs, which is angiotensin 2 receptor blocker, the silent protector, this protects your heart. When you take this drug, it protects your heart. Like when ACE, which is ACE inhibitors, causes that notorious cough, ARB become the next best alternative. They work on the same hormonal system but take a slightly different route. Instead of preventing the formation of I hope we are getting it. Instead of preventing the formation of angiotensin 2, ARB blocks its effect directly at the receptor site on blood vessels. All right. Now, these ARBs, they are the silent protectors that protect our heart. And these drugs gently relax the arteries and reduce strain on the heart without interfering with other body system. All right, so that's why it's very important and very essential for your healthcare professional to follow you closely when you are taking your BP medications. All right, now some common generic ARBs include Lexotan. Yes, they include Lexotan. And please, we need to look at the active, I've said it earlier, we need to look at the active ingredients in our medications. All right. Now, these medications are frequently combined with other classes, such as diuretics. To enhance their effect, it's very important to combine your BP drugs. This will make the effect to be enhanced. All right, because in recent years, ARB have also appeared prominently in medication recalls in recent years, particularly those improving impurities formed during manufacturing. These incidents highlight why patients and healthcare professionals must pay close attention to official recall notice and verify badge information. Now, some common side effects of ARBs are generally well tolerated, unlike the ACE inhibitors, but that have dry cough, fatigue, dizziness. Those are some common effects of ACE inhibitors. But these ARB are their side effects are generally well tolerated. Not like that of the ACE inhibitors. All right. Occasional effects may include dizziness. Listen, occasional effects. So the side effects are actually occasional, and this effect can include dizziness. It can also include mild fatigue, or high potassium level. They are not recommended drugs during pregnancy. So for women that are pregnant, they are not ARBs. Drugs are not to be prescribed for women that are pregnant, all right, as they can affect fetal development. So that's the reason why it's not be prescribed to women that are pregnant. Why this ARB matters? ARB offers the same protective benefit for the heart and kidney as ACE inhibitors, but with fewer side effects, like I said earlier. All right, they are particularly useful for long-term management and combination therapy for patients switching from a recall ACE inhibitors. ARBs are often a legal and safe alternative for this particular patients. All right, now let's talk about beta blockers. These are slow the rhythms of the heart. All right, when your heart is beating fast, these drugs, beta blockers, help this heart to calm down. Imagine your heart as an engine that speed up under pressure. Every worry, every exhaustion, every signal from your body add fuel to the fire. But what does beta blocker have? As the mechanic that gently limits this stress, limits this beating, limits this agitation. All right, they work by blocking the action of adrenaline, which is epinephrine, the fight or flight hormone that makes the heart beat faster and harder. This drug help by slowing the heart rate and reducing the force of each contraction. Beta blockers lower blood pressure and help prevent heart strain. This is the work of beta blocker. Some common generic beta blockers are atenolol. These are some drugs that help to calm this epinephrine flight and fight action caused by the hormone adrenaline. Now, one of those drugs are atenolol, all right, or propranolol. Beta blocker are not only the first choice for primary hypertension, but they are indispensable when high blood pressure coexists with heart disease, irregular heartbeats, or a history of heart attack. These drugs, they stabilize the heartbeat, prevent complication, and improve survival after cardiac events. All right, what are some common side effects of this drug? Some common side effects of this drug, because they slow the heart, patients may feel tired, light-headed, or unusually cold in their hands and feet. Some may experience vivid dreams, mild depression. For people with asthma, certain beta blockers can worsen breathing issues. So careful selection is encouraged. Careful selection is really essential. Why these drugs, beta blocker, matters? Beta blocker matter because they play a critical role in the border of the cardiovascular system. All right, they play an important role there. They protect the heart from overwork and calm the system during stress. In the era of medication recalls, patients on beta blocker must remain aware of their specific formulation, as sustained release and immediate release types can differ in manufacturer sources. Now, I'm going straight to talk on calcium channel blocker. Calcium channel blocker easing the flow. This drug help to ease the flow. While beta blockers calm the heart, calcium channel blocker relax the blood vessels wall. Calcium is a key mineral that helps muscles contract, including the smooth muscles lining the arterial wall. By blocking calcium entry into those cells, CCB, which is calcium channel blocker, prevents excessive tightening, allowing blood to flow more freely within the heart and when the blood is pumping to the entire body. These are two major types of calcium channel blocker. What do they do? Now, they focus on relaxing blood vessel, e.g. amlodipine. They relax the blood vessel of the heart chamber, and they also affect both blood vessel and heart rate. They have effect on blood vessel and heart rate by easing the flow. These medications are especially helpful for older adults and people of Africa or Caribbean descent, for who ACE inhibitor may be less effective when used alone. Alright, an example of calcium channel blocker is amlodipine, nifedipine. These are some of the examples of calcium channel blocker. Some common side effects include ankle swelling, headache, flushing, or mild constipation. This can occur when you are using one of these drugs of calcium channel blocker. So if you are taking one of these drugs and you are complaining of complication, please just calm down, because mild constipation is one of the side effects of this particular drug, calcium channel blocker. For example, nifedipine, amlodipine. All right. Now, why this matters is that they help to relax the flow. All right. Now, I'll be going straight to talk on the last 5 classes of blood pressure drugs that are recognized globally, which is the diuretics. I hope I'm communicating. The story of diuretics, often called water pills, goes back decades. They have been using it for decades, all right, but their relevance has never faded. They are still in use. These medications help the kidney remove excess salt and water from the body, effectively reducing the total volume of fluid circulating through the blood vessel. Less fluid means less pressure on the vessel wall. All right. Diuretic comes in several forms. I want us to know that. And we should not forget that it's also called the water pills. Diuretics comes in several forms. Like, can someone tell me in the comment section? Can someone tell me? So we have loop diuretics like furosemide. All right. Furosemide is stronger and often used in heart failure. So this furosemide helps to remove excessive fluid from the body. So furosemide is basically and most importantly used in heart failure. All right. Now, what does this do? It helps to remove excess water from the body. I will be talking on some common side effects of these drugs, because I know since I've started, I've been talking about the common side effect of all the medications being listed. So furosemide should not be left out. So let's talk about the side effect of this diuretic, furosemide. Excessive urination. You see this patient, after giving he or she this medication, they urinate frequently. So don't be scared when you urinate frequently. They have low potassium. There will be dizziness or mild muscle cramps. Patients are often advised to monitor electrolyte and stay hydrated when taking this furosemide. Now, why does this matter? Diuretics are simple but very yet much powerful for many patients. All right, so I will be stopping here tonight. In my next video, I will continue. Please don't forget to subscribe to this channel, as more help tips will be coming to you. I still remain your girl, OG Health. Your health, my first priority. Heart series is still on. We are still talking about it, and there is a vital information on this YouTube channel. All right, so I will encourage us to check on this YouTube channel and go through the information. Now you'll be asking, what is this information? Since we are talking about heart series, which is our heart health, our hearts need to be healthy because it's the powerhouse of our body. It's the heart that pumps blood all over the body, carries oxygen. The heart does a lot of work. So that's the reason I've taken our time to talk about blood pressure medication and its recalls. All right, this is going to help you. Just check on this YouTube channel, read it, especially those that are already hypertensive. Please, I encourage you to do that. All right, it's going to benefit you a lot. And don't forget your drugs. Always read the body of the pack before you take your medication. Read the leaflet inside the drug before you take your medication. It's very important. And all this was really perfectly explained on the video in this YouTube channel. So I will encourage you to take out your time and go through it. There are 5 types of blood pressure drugs recognized worldwide that you will still know in that video. All right, so don't forget, your heart must be prioritized, and your heart is not to be joked with. All right, so enjoy your weekend and like, share and follow. All right, it's still your girl, OG Health. So Mary, healthcare professional, explained to her, just as I'm explaining to you now, that Mary, think of your arteries like garden houses. If you turn the frequency too high for too long, the houses wears hard. It may crack or it may even burst. So this simple analog stayed with Mary. High blood pressure does not just affect one organ. All right, high blood pressure does not just affect one organ. All right, it exerts quietly, causing constant damage throughout the body. And the heart over time gets tired. The heart must pump harder against resistance, thickening its wall. And this, we now call it as a condition of hypertrophy. Eventually, this strain may lead to heart failure. That's why you see people having heart failure. And what about the brain? The persistent hypertension increases the risk of stroke, either by rupturing a weakened vessel or clotting it with clots. What about the kidney? These vital organs are very delicate and they are very, very important, filled with tiny vessels that can scar and harden, leading toward kidney disease. What about the eyes? The small vessels in the retina of our eyes can be damaged, affecting your vision. So that's why it's very, very important for us to put our priority on our heart's head. The small vessel in the retina can be damaged. So high blood pressure can actually affect the organs in our body: the brain, the kidney, the eyes, the heart. What about arteries? Continuous high pressure accelerates atherosclerosis. Please, we need to put more priority on our hearts. All right, the build up of fatty plaques that can block blood flow in our hearts. Hey, please. And yet most people feel nothing. They feel nothing. They walk, they laugh, unaware that danger is coming. That's why regular blood pressure check are vital. A single reading might be misleading, but repeated check tell the real story. A single reading might be misleading, but repeated check tell the real story. Now, why is medication important? Why medication is important? When Mary, healthcare professional, prescribed her medication, she hesitated. Can't I just eat better and exercise? She asked. But the healthcare professional smiled kindly. Lifestyle changes are powerful and sometimes enough, but for many, the body needs a little help. Medication don't cure hypertension, they control it. All right? Their role is to reduce the pressure inside the arteries, easing the heart workload and protecting vital organs. These are many kinds of blood pressure medicine. Some relax blood vessels, others reduce fluid in the body, and some slow the heartbeat. The right choice depends on a person's age, height, and response. The right choice depends on the person's age, height, and the response. But here is the truth. The real challenge is not starting medication, it's staying on it. That's the real challenge. Many people, once their numbers improve, they will stop taking their pills. They think, I am fine now, but hypertension is chronic. It returns silently when treatment stops. Missing doses can cause pressure to rebound sharply, sometimes triggering stroke or even heart attacks. That's why your healthcare professional emphasize on consistency on taking your medication daily. Even when you feel well, check your blood pressure and take your medication daily, because this will help you a lot. And what did Mary learn? Mary learned this lesson the hard way. All right, months after she was diagnosed, feeling strong and symptoms free, she skipped her tablets. Within weeks, she found herself in the emergency room with pounding headache and blurred vision. Her blood pressure has increased so dangerously, so high, it has gone up. And that night, she promised herself never again to take it lightly. She promised herself to keep consistently in taking her medication. She promised herself that this will not happen again. She needs to also engage in lifestyle changes and also keep taking her medication strictly. Now, controlling blood pressure is not only about medication. I will say that again. Controlling blood pressure is not only about medication. It's a life approach, a commitment to balance. So let's take note of that. Because when Mary begins her journey, she knows that yes, she is into it. She discovered that healing isn't a single heart, but a collection of small, consistent choices. That is what healing is. She learned to cook differently, using herbs. She also used lemon instead of excess salt. She used herbs and she used lemon instead of excess salt. She began taking slow walk, and around her neighborhood every morning she takes walks, at least 20 minutes walk. Watching the sunrise, she does that. Her stress heals within time. Sleep comes so easily for her. Her energy returned. I don't know if I'm communicating, and I hope I'm communicating. Science back up what Mary discovered through experience. They said experience is the best teacher. But what Mary discovered through experience, I want to let you know that science backed it up. A balanced diet rich in fruits, vegetables, proteins, and whole grain helps regulate blood pressure naturally. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains helps to regulate blood pressure naturally. Regular exercise strengthens the heart, making it pump more efficiently. Adequate rest restores hormonal balance. Even simple breathing exercise can calm the nervous system, lowering blood pressure temporarily. Every each step seems small, but together they reshape the body, internal heart health. So your blood pressure cannot be joked with. Or let me rephrase, your heart cannot be joked with. Please and please put it as number one priority. Your heart health is key. All right. Now, understanding the number, empowerment through knowledge. When you understand the number of your blood pressure, I want to let you know that it will empower you. So one of the most empowering thing a person can do is to know their number. Know your number. Blood pressure monitors. Please monitor your blood pressure. But once found only in clinics are now available in pharmacies and home. So please, you can even get your blood pressure cuff. You can get the machine and keep using it in the house. Learning how to measure, track your reading can transform your head from mystery to awareness.